Hello, I'm Kate Shepherd Cohen. Today is my day 20. I've just transitioned into the inner autumn of my menstrual cycle, into my luteal phase. I'm feeling a sense of calm in my nervous system, especially compared to having my foot on the accelerator last week in my ovulatory phase. Now, many of you will recognise this simple, mindful, daily practice as menstrual cycle awareness, created by Alexandra and Sjanie Hugo-Wurlizer of Red School. Because of its transformational effects on my own life, taking me from a place of having PMDD, suicidal ideation, severe depression every single month, which was extremely debilitating. Because of the transformational effects that menstrual cycle awareness had on my life, I became determined to share it with others, particularly to take it into healthcare. So that I dreamed of the idea that if you went to see a healthcare professional, they could prescribe you menstrual cycle awareness as a practice, of course, to understand it alongside other medical interventions. So I've set about putting it into healthcare and, of course, trying to make it as evidence-based now as possible, collecting as much robust data as I can. Through my organisation, Menstrual Cycle Support, we released our first impact report, which was carried out by 2 independent academics, of our digital course on menstrual cycle awareness that we've made available through social prescribing in over 500 GP surgeries across the UK. For anyone who has practiced menstrual cycle awareness, you won't be surprised to hear that the initial findings from our online survey show a very statistically significant increase in people's confidence, having done the course on menstrual cycle awareness, in speaking to healthcare professionals. Of course, we're hoping that this is then going to speed up diagnosis times and help them get the services and support they need much, much quicker. We also found a very high statistical increase in people's relationship to their menstrual cycle, and we know then the ripple effects that has on work, family and social life. And we used a method called MyCore, which has been approved by the NHS, and this has been really important with taking a practice like menstrual cycle awareness into mainstream healthcare, having to underpin it with therapeutic practices to ensure that it follows NHS guidelines and NICE guidelines as much as possible and as closely as possible. We put the whole programme through quite rigorous regulatory assessments by identifying the digital course as being part of a health tech. So it's been assessed by ORCA, and it's lives currently on their clinical directory. It's scored very highly there. So all of this is really important in the journey to take this to the point where all healthcare professionals can actually prescribe menstrual cycle awareness as an intervention alongside pharmaceutical products. We would very much like support with this. So if you are interested in menstrual cycle awareness, please do get in touch with me, kate@menstrualcyclesupport.com, as we go on the road. We're on it towards making menstrual cycle awareness a clinical intervention, especially in primary care. Thank you so much. Bye.